The contents of this program may not necessarily represent the views of Ummah Channel.
Welcome back. My name is Shakil Salam and you're watching Ummah Channel, the health show Hamari, Sehat. Every week we bring you the show with a different personality, different health professionals to talk about specific health issues. And today we're going to look at the healthy lifestyle for the new year. New year, what is going to bring it for us, what changes we need, and also we're looking at the lifestyle. What happened in olden days when our parents or grandparents used to have small portion of food and it's been eaten by the whole family. We share food and we still needed and reasonably healthy, not very obese. But now things have changed. We become modern, affluent, and we don't need to do things. So let's talk about healthy lifestyle and changes we are making at the same time. If you would like to ask any questions to Dr. Faizan, Ahmed, who is our guest today, he's a GP in Manchester and kindly came to talk to us about the healthy lifestyles, the new year, the new beginning. There's a lot of tips, a lot of discussion, and you are welcome to join the discussion. There's a telephone number on the screen. Please do call us. So I remember my youth, my childhood, born in a small village in Pakistan, and small dish, small portion, small handi size, small portion of plate, and just one little chapati. That was more than enough for me for lunch. But now, perhaps, everything is supersized. Do you think that is a lot to do with our sizes as well?
The cynic within me says there's always market forces involved, and we sort of laugh about this, but it's become increasingly apparent that we've Americanized almost our lifestyle behavior. A lot of the portions have increased in size. In fact, because of the way food is marketed, the more you buy, the more you consume, the cheaper it gets. And that's reflected also in the cutlery and the crockery that we use. If you think about plate sizes, as you alluded to, when we were younger, they were much smaller. Now, the food is such that you need vast plates. We're looking at our table in the studio here. We've all been to various eateries that, that's the typical size of the plate to be shared by 4 people. That's not uncommon anymore. We were always told as trainee doctors that take your left hand fist, and if you sort of put that over the plate, that should be your full meal. So everything that you're having, that should be your portion. If we look at our own body size, the fist is relative to that. That's not a lot, is it? In the scheme of things.
No.
And in real terms, when we go out, we'll have a starter, and quite often the starter will be the size of our fist. Yeah. We'll then have the mains, which will probably be about 2.5 fists. And then we'll of course have a dessert, and that'll be another fistful. So, the quantity we're having is really risen in size, and these simple psychological things have impacted us over a generation now. And I think what we can do quite quickly is start to look at that, because interestingly, if we look at the high-end catering, most restaurants, whilst they'll have quite large plates, the portions on them are absolutely tiny. Whatever one's feelings are about that, whether you're getting value for money and so forth, places like that there's one thing we can give them. One is portion control, and two is actually recognizing that you don't have to do too much to the food for it to taste nice. And you know, I watch the same programs that we all watch at home. You know, most of the high-end Michelin-starred chefs, they win most of their awards through the fact that they don't do much with the food. And it's tiny and it's petite looking, and it should leave space in the tummy. That's another thing we've sort of moved away from, that, you know, those of us that are Muslim, we were always taught that, you know, split your stomach into three, have a third of food, have a third of water, and leave a third empty. And that, you know, is advice that's over nearly 1,500 years old, and that still stacks up from a scientific point of view. So we're fortunate in the fact that we're Muslim, and I think we should heed that advice that was given, and it's so simple.
That was a very good point. And also I'm looking at the hospitality in our community. You go to somebody's house and all of a sudden, without any question, they'll brought you loads of food, and then you go to somebody else's house, it's the same thing. Now, hospitality is part of our culture, it's good, but at the same time, you know, it's the enforcement as well, you know. People get upset, you know, if you don't eat and if you refuse food.
And I think you're absolutely right, the pressures that we put ourselves under, and actually those of us that are hosting can do a few things. So, for example, the traditional tea that's brought out, why not have sugar there? Why not have a more natural sweetener, like a little bit of honey? Or if you absolutely must have a sweetener there, have something that's non-sugar based, or something like a stevia or something, a sweetener of that sort. There are other issues around the sweeteners that we're only now finding out. Some of them are linked to cancer, so I'm pained to sort of advise on those. For me, it's about the natural thing. But nuts are a common thing that we bring out. But those nuts tend to be roasted and coated with all sorts of things. Just bring out some raw nuts. We tend to want to bring out biscuits and things like that. Why not replace the biscuits with something that's a little bit more healthy? The sort of solutions, and I'm not the best of caterers in that regard, but anything that in essence is natural, so something around, why not have some vegetables that you've cut yourself, that you've stuck in the oven and seasoned yourself, turn them into a bit of a snack.
Absolutely.
You know what you've put on it, it's healthy, and guess what? Because it's not fried, the likelihood is your visitor is likely to have it and not feel guilty that they've gone against what they had promised themselves in terms of their health.
Absolutely. Yeah, fantastic advice from Dr. Faizan Ahmed. There is a lot of points we need to take up and practically do it. And I think the important thing is we need to make changes. Small little changes will make a huge difference. And to be honest, you know, it's better to have small changes than promise big and not able to do that. So little small changes, and this is where we're getting a lot of advice from our expert, Dr. Faizan Ahmed, who's a GP in Manchester, and he's kindly come to talk to us about healthy lifestyle in 2017. If you have any questions, anything you would like to talk to Dr. Faizan, or you have any concern or share your experience, you know, have you done anything to improve your health and well-being? Has your health been affected and you would like to see the changes? What changes make a huge difference to your life, your family's life? And to be honest, you know, and Dr. Faizan, I think I only met you 8-9 months ago when we did a show, and you look a lot healthier and smarter now. Have you been doing some exercises?
Thank you for noticing. So it's always a bit of a cliche when any sort of health professional is imparting advice and not taking the advice themselves. So one of the certain things that I've promised my family, who obviously worry about me, and my peers worry about me, is that, you know, I've tried to do a little bit of lifestyle modification. So I've tried now. I've never been a breakfast eater, for example.
Right.
So I've now started to have breakfast. I was never one for particularly having fruit and vegetables, but again, you know, it's about if it's presented in a way, and if you do it according to your taste. You know, if as my wife will tell you, if you can persuade me to have bangan, which is eggplant, you can pretty much get everything past me. So rightly so, and the gains are there to be felt, really, and you know, one feels more energetic. You're able to do much more through the day, and you feel less tired when the day finishes. And I think ultimately, you know, we as Asians generally, we tend to start to feel the aches and pains much earlier, and we tend to start feeling sorry for ourselves. And I think the more we can do for ourselves and not need to come to people like me for medicines to try and help us, the better for us in the long run.
So you're trying to save your time rather than So to be honest, you know, I think you're absolutely right, because when you talk to a lot of your aunties and uncles, the main concern is, oh, jodana dard, arthritis, you know, pains, aches. What is the reason behind it? Why do we get these aches and pains in such an early age? You know, we're looking at 50 onwards.
Sure. So the main reason, interestingly, is because we don't tend to move our bodies the way they were designed to. So we, for example, the two of us now are sat on a sofa, and there's only a couple of muscle groups that we're using. One is a group of muscles to keep us sitting up straight a little bit, and two is the bottom muscles just to keep our posture a little bit straight. But beyond that, we're not really doing much apart from moving our mouth when we're speaking.
Yes.
But really, that's a sense of how we've become, that actually, if you don't use something, if you look at doors and windows, if you don't use them often enough, they become creaky and they become stiff. So it's really about keeping your joints moving. And interesting enough, one of the main advantages again of being a Muslim is the act of praying and namaz and salah. Like we use muscle groups that we don't necessarily use throughout the day, whether it be driving a car or walking up and down stairs, etc., etc. So ultimately, we're not doing anything different. It's just about making sure that every bit of our body moves now once in a while to keep ourselves going. The other thing is, and sadly this is because of where we are, we know in our community vitamin D is a big issue.
Massive.
And generally nutrition's a big issue. So because we lack sunshine in this country, our bodies can't make enough vitamin D to sustain us. And we know that affects our joints in terms of aches and pains, and generally our well-being and our ability to fight infections. So there's something about having yourself checked to make sure that your vitamin D levels are adequate. And if they're not, there's no harm in taking a supplement. And certainly I would always advocate between October and April in Britain, we should be taking some vitamin D supplementation. Go and speak to your pharmacist who'll give you some advice about what dose is appropriate for you. You're not going to cause any harm in the dosages that you can get over the counter, but they will make a difference in terms of how you're feeling.
Mm. And sometimes people wait until they're seriously ill to go and see a doctor, or seek advice from a chemist, pharmacist, or any other, or a nurse. How important it is to have regular checks and make sure your blood pressure is okay, you're not getting diabetes, the sugar level is okay. Are these tests available at your GP practice?
Sure. So one of the wonderful things that remains about the NHS is that we've got lots of opportunities to have these checkups completely for free. Now, there are lots of pharmacies up and down the country where you don't need an appointment, where you can go in, have your blood pressure checked, your weight checked, your sugar level checked, your cholesterol level checked, and you will be given advice accordingly. There are lots of health check buses and facilities that may be visiting your area where you can get regular advice. Certainly within our community, increasingly, we used to say anybody over 40 should have an MOT fairly regularly. If you've got a problem, you should be having an annual MOT. So if you've already got blood pressure problems or you've got diabetes, you should be having an annual checkup anyway. But if you haven't developed anything, certainly increasingly for our community, the earlier the better. Only recently, sadly, I was diagnosing kids in their 20s with diabetes, and sadly that's come about because we haven't looked at our community in the way we should have done. So there's something about utilising the facilities that are there that you don't necessarily need an appointment for if you're struggling to get in with your doctor. There are other ways you can access it. The easiest way to find out where is to visit the NHS Choices website, which is www.nhs.uk, or you can alternatively ring 111, who will give you some advice about where to go. Some GP practices now have online consultancy services on the NHS, so you don't have to pay for that, but you can contact them online and again find out some further information. Most GP surgeries have websites which will have links to various organisations that may be doing health checks in your area, and it's worth going down.
One of the key sort of comments we're getting, smoking is a massive thing, and a lot of people, that is probably a priority for them as well, and they're saying, well, this year what I'm going to do is I'm going to give up smoking. How easy it is and how difficult it is to give up smoking, and is it possible that people do give up smoking and become a healthy and a well person?
I think the way to look at smoking for us is to talk about nicotine addiction. Now, the stuff within smoking that makes it addictive is a drug called nicotine. And nicotine is found in tobacco cigarettes, it's found in shisha, it's found in barn. And the sad reality for most people is they become addicted to nicotine, not the actual tobacco they're chewing or they're smoking or they're inhaling. And whilst we're saying for the health benefits, the first and foremost thing should be about is getting yourself off something that's going to cause harm. And we know, for example, in barn, the other elements of barn increase the amount of oral cancer, etc., and also heart disease and so forth related to the tobacco side of things. In smoking, we've known for years that the cancer links, the stroke and blood pressure and heart attack links, and including impotence, the ability to have sexual drive and so forth. And certainly when it comes to shisha, we're going to see a bit of an explosion in the next few years because people have it's just become part of communal activity now. We're probably going to see the after effects of it in the next few years, and we're worried. We're certainly worried about that because younger people seem to see that as something they can just do with friends and peers. But for me, there's something about getting the tobacco out of your system. So it's about, for example, we've got the electronic cigarettes at the moment, whilst these will have their own issues, what we certainly know is they don't have the same health concerns that tobacco has. So whilst you've got your nicotine addiction, try switching to something like electronic cigarette, which will give you the nicotine hit without necessarily giving you all the other harmful effects that we know associated with smoking and barn chewing.
Absolutely, thank you very much. And you're watching Ummah Channel, Sky 820, Hamari Sehat, the health show. Dr. Faizan Ahmed is talking about the lifestyle. We touched upon smoking and shisha. We'd love to hear from you. If you've got any concern, any questions, please do call us. We're going to have a short break, and inshallah after the break, this is the final part of the program, where we're going to give you some key tips for 2017, being a healthy, happy and active. How can you do that? Find out after the break, inshallah. See you later on. Assalamu alaikum.
The contents of this program may not necessarily represent the views of Ummah Channel.